Okay, hello. My name's Tate Rotzel, and I chose early childhood development. I have six young children. Well, I say young. I have 11 all the way to a year old, so it's just kind of a topic I was familiar with. The physical development, gross motor skills, refinement, running, jumping, climbing, hopping, and balancing become more coordinated and controlled. Fine motor skill, improved hand-eye coordination, allowing for activities like drawing, buttoning clothes, and using utensils with greater dexterity. Physical growth, obviously increased in height and weight during this time. And a typical development example, a child showing significant delays in achieving a gross motor milestone, such as not being able to run smoothly or climb stairs independently by age 4. And that could indicate a developmental concern. My son, he was 6 months old, couldn't sit up on his own, couldn't crawl, couldn't feed himself with his hands. Like the left side of his body really didn't do a whole lot. He didn't use it at all. So we was going to Oklahoma City probably once a month for like 9 months, doing all these tests, testing them for syndromes, anything we could find, something, because something was not right. Well, all these tests kept coming back normal, no issues whatsoever. We were in physical therapy, speech, all kinds of different therapies. And finally, he just started improving. Like he was a small child as it was anyway. He's 8 years old now. He runs around. He's completely normal. No issues whatsoever. He's doing great in school. No delays at this point. So it's always important to catch that early versus late. If you feel like there's a issue in the development, physical, any kind of developmental issues, don't be afraid to seek out and get the help, because it only helps your child in the long run. Biosocial development, self-awareness and identity formation, increased understanding of self, including gender identity, personal characteristics and emotions, social interaction skills, development of cooperative play, sharing, taking turns, understanding social cues, and emotional regulation, ability to identify and manage emotions, expressing feelings more appropriately. And in a typical development example, a child that consistently displays extreme outbursts or struggles to regulate emotions in social situations, potentially indicating challenges with emotional control. I go through this almost every day with our young kids, obviously, as toddlers and kids just expressing themselves, whether or not getting a toy at Walmart or getting a Happy Meal from McDonald's. If they're not afraid to show their emotions, I don't know if that's necessarily age appropriate for them. My older kids, they obviously get excited, but they know when to be quiet, when to act crazy, so on and so forth. So cognitive development, symbolic play, engaging in pretend play, using objects to represent other things, like using a block as a car. I do that all the time too with my 1-year-old and my 3-4-year-old. We all play. Language development, rapid vocabulary expansion, forming complex sentences and understanding grammar rules. Early theory mind, developing the ability to understand others' perspectives and emotions, recognizing that others may have different thoughts and feelings. And a typical development example, a child who shows significant difficulty with language comprehension or production, such as not being able to follow simple instructions or use basic vocabulary appropriately for their age. With that, I mean, I have had a couple of my children be in speech to understand what they're saying, how to say it. The not being able to follow simple instructions. I mean, you'll run into that with obviously younger kids. And then some extra points to remember. Development is not linear, and children will progress at different paces. I've all 6 of my kids. None of them have progressed the same. My oldest didn't walk till she was 13 months old. My second walked at 9 months. So I mean, just each kid's different. You can't compare one child to another. And then observing a child's development across multiple domains, physical, biosocial, and cognitive, it provides a more comprehensive understanding of their progress. And then early intervention is crucial if concerns regarding a development are identified. Like I was saying earlier with my own son, my wife was very good at noticing the little things that made her concerned. We got tests ran, we got all this done within a year, and now 7 years later he's functioning normal. Everything is perfect with him. He's doing great in school. He's a typical 8-year-old boy. Crazy, hyper, excited, all the things. He's ready to play football. So we're getting the early help made a huge difference. So don't be afraid to seek help with your own children, or suggest it to other people that are having issues that they may not know are issues.